Yeah, we go. Perfect.
Yeah, is this visible, sir?
Absolutely,
Yeah.
absolutely.
जरा enlarge करो साहब, enlarge करो.
This is fully enlarged, sir. हमारी आँख की screen fully enlarged है.
Okay, ठीक है जा. Okay. Meeta is joined.
Bharat Bhai has to start.
Can I
Meeta
start?
is-
Can I start?
Meeta is there, then start.
Yeah. So good afternoon, everybody. On behalf of Jaslok Hospital and GPA, I welcome you all on the occasion of this 292nd Web CME, which is our ongoing CME every Thursday. So may I now request our today's moderator, Dr. Meeta Adia, to take care of the proceedings.
Oh, thank you, Doctor. I'm audible?
Absolutely.
Yeah, continue.
Thank you, Dr. Dolakia, Dr. Bharat Bhai, Dr. Saurabh Shah, and good afternoon to everybody, whosoever is online also. Today, our speaker is Dr. Saurabh Shah, who is MD DNB Dermatology. His center is at Mani Mahal Opera House, and his current position is as a medical director and senior consultant dermatologist, dermatosurgeon, venereologist, and aesthetician at Advanced Skin Care and Hair Clinic, Mumbai. And he is a visiting consultant dermatologist, cosmetologist, and dermatosurgeon at Bridge Candy, Wokhad, Bhatia, and Saifi. He has many past professional experiences and qualifications. He has achieved many things, and he has presented paper also, publication and general position, and he was invited in national and international conferences also. So may I request Dr. Saurabh to have his talk on hair fall and hair loss. Thank you.
Sure. Okay. Is it visible now, everyone?
Yes, sir. Yes, sir.
Okay, great. So, very good afternoon. First of all, thank you so much. It's truly an honor to be a part of such an academic feast. You all family physicians are so enthusiastic about learning that it is truly inspiring. Thank you, Dr. Bharat sir. He was the one who actually, reached out to me and asked me about these wonderful sessions that you have every Thursday. And Dr. Dholake, of course, who is age is just a number for him. I'm sure he's still so enthused and he's still so excited about learning, and that's actually what matters. Because life is life as like science is always evolving, and we always need to keep ourselves updated. Well, so without wasting more time, let me just briefly introduce you to my topic today: from hair fall to hair loss. Uh, it is one of the most important and the most prolific topic that we all skin specialists face these days. Almost every second, third patient is complaining of either hair fall or hair loss. Well, how hair is the crown you never take off. Need to wear it with pride and take care of it with your soul. Hair is a cutaneous appendage typical of the mammalian skin. In human beings, although hair has lost its biological significance, its cosmetic and aesthetic importance has been increasing over the years. Did you know that human skin roughly has about 5 million hair follicles? That is about 50 lakh hair follicles, maybe even more, but not less. The human scalp has roughly about 1 lakh hair. The average daily loss of hair is about 50 to 100 strands per day. So if your patients tell you that, doc, I'm losing a lot of hair these days, 5, 10 hair I see in the morning when I wake up or when I shampoo, just tell them relax, because losing even up to 50 to 100 is considered to be normal. In fact, there are certain months of the year wherein losing a little more than this is also considered to be normal. It's called seasonal hair fall in India. So we have months like May, June, and December, Jan, during which uh, people in Southeast Asia and the Indian subcontinent, for some reason, are having more hair fall, and that's a term called as seasonal.
Hair fall, hair fall.
Hair on the
अच्छा, hair
scalp
fall.
grows roughly at around 0.3 millimeters per day. It's been a source of Bollywood inspiration. You must have heard so many songs which are just based on the heroine's hair. You know, ये रेशमी जुल्फों का अंधेरा, खुली जुल्फों ने सिखाई मौसमों को शायरी, उड़े जब जब जुल्फें तेरी, and तेरी जुल्फों से जुदाई तो नहीं मांगी थी. That's how important our even old time Bollywood lyricists knew about the importance of hair that will be impacting human lives. This is what hair can do to you. Look at Shah Rukh Khan at 59 and Akshay Khanna at 50. Makes you look more young, more energetic, more fresh. That's another analogy. An African lion who is 9 years old compared to a Asian gill lion who's just 4 years old but bald, making him look even more old compared to his old African counterpart. Well, contents of this presentation. We understand the structure and function of the human hair. We understand the difference between hair fall and hair loss, that is called baldness. Treatment modalities like minoxidil, finasteride, the thing in vogue these days, PRP, platelet rich plasma, and lastly, basic hair care. So, well, types of human hair. There are three types of human hair. Lanogo are the hair which are seen in utero. Vellus hair are the thin, small, light, unpigmented hair which are not easily visible to the naked eye, but they are present all over the skin. And terminal hair, which are the thick, dark, long pigmented hair which we see and which we usually term as hair, like the eyebrows, the eyelashes, the scalp, the hair on our extremities, chest, back, etc. All these that we see are terminal hair. The vellus hair are the thin, light hair that usually are not that visible. They are much more thin and they are unpigmented compared to the terminal hair. Hair is nothing but a keratinized product. That is a thick product with compact layers of keratin, okay, of the hair follicle. It is present all over the skin except lips, palms, soles, and the skin of the nail folds. Well, what are the various functions of hair? We got to know about the structure, but what about the various functions of hair now? So, most important function is thermoregulation. It acts as an interface between the external environment and the skin. Hair also traps the warm air in between the skin, thus keeping the body warmer. It acts like a physical barrier, provides mechanical insulation. It provides immunity and protection, for example, passages, ears, and eyes. Sensuousness is another important function where it adds a supplementary cosmetic beauty to the body, and touch for psychosexual communication. Well, hair cycle. Hair follicles on the scalp do not continuously produce hair. Hair follicles undergo a repetitive sequence of growth and falling called the hair cycle. They cycle through the following three phases. The first is the growth stage, which is the anagen stage that can last for anywhere between 2 or more years. The anagen phase depend it actually decides what is going to be the length of your hair. If the anagen, that is the growth phase of the hair, is just 2 to 3 years, the hair will not really grow beyond the neck, like usually how males have. If it's 3 to 5 years, the females can have the hair growing right up to the shoulders. 5 to 7 years, even longer. And for some females, where the anagen phase is roughly about 8 to 10 years, we see their hair growing right up to the buttocks and the knees. So it is genetically determined, and we cannot really change the anagen phase of the hair. Regress to a resting stage, that is the telogen phase, for up to anywhere between 2 to 3 months, and shedding stage, that is roughly up to 2 weeks, that is called the catagen phase. So hair goes through this cyclical transformations which are called the hair cycle: the growth phase, the resting phase, and then the shedding or the falling off phase. At any point of time, healthy human scalp, about 80 to 90% of the hair follicles are in the growing, that is the anagen phase. Up to 10 to 20% are in the telogen phase, and the rest 1 to 2% are in the catagen or the shedding phase. Well, talking about, as I told, the difference between terminal hair and vellus hair. Okay, the terminal hair being thick pigmented hair and the vellus hair being small, fine, non-pigmented. Example, the hair on the face. Talking about the structure, vertically we have the hair follicle, which have the dermal papilla cells which grow the hair, and finally when it shoots out of the skin, it is appreciated as a hair shaft. So it is basically three concentric layers, each hair strand, innermost being the medulla, outer cortex, and the last one, the cuticle. Well, so talking about telogen effluvium, which is hair fall. So we learned about the structure and function of hair. Now we are talking about hair fall. Then we'll go to hair loss. So hair fall, one of the terms that we use for hair fall is effluvium, which means outflow, which means losing hair. So seasonal increase during May, July, and December to Feb, and you will invariably have patients walking in your clinic and telling you, डॉक्टर साहब मेरे बाल बहुत गिर रहे हैं, मैंने साफी भी पिया, लॉरियल भी यूज किया, लेकिन फिर भी नहीं फायदा हुआ. So some hair loss conditions go by the name effluvium, which mean outflow. Effluviums characteristically affect the different phases of the hair growth cycle. Sudden significant hair loss 2 to 3 months after an offending insult, where hair follicles are pushed prematurely from the anagen to the telogen phase. So the 80 to 90% of the anagen hair growth, when some percentage of it goes into the telogen phase, that's when the hair from the active growing phase, they shift to the telogen phase, and from the telogen phase they naturally get into the catagen or the shedding phase, and hence the patient complains of lot of hair shedding. The entire cycle dynamics just shifts because of certain insults. The most common insults being fever, long lasting, that is more than 5 to 7 days. We know of a lot of patients undergoing all such sort of viral and parasitic infections like malaria, dengue, typhoid, COVID, etc. And that can really take a toll on one's health, especially the hair. Postpartum hair fall is a very known phenomenon. We have crash dieting, especially Jains who really indulge in some austerities like tapasya and some exotic fastings. Hypoproteinemia, iron deficiencies, major surgeries, prolonged anesthesias, hypo and hyperthyroidism, major internal diseases. Acute psychologic stress is also known to trigger sudden hair fall. And medications. There are certain medications like systemic corticosteroids, retinoids, and certain psychotropic antipsychiatric medications which can actually trigger a sudden significant hair fall. So, a loss of hair is called alopecias. We have non-scarring and scarring alopecias. Non-scarring alopecia, the most common one being pattern hair loss, that is androgenetic alopecia. Then we have alopecia areata. And alopecia areata is not because of a fungal infection. So please don't give your patients antifungals for alopecia areata. It's an autoimmune condition. Then we have telogen effluvium, drug-induced alopecias, traction alopecias, trichotillomania, which is an obsessive compulsive disorder of continuously removing the hair and plucking the hair off. Then alopecia due to other systemic diseases like lupus. Then we have the scarring alopecia, that is tinea capitis, cellulitis, burns, and radiations. So, scarring alopecia, the potential for hair regrowth is as good as nil. In non-scarring alopecias, there is still some potential for hair to grow back. So, this is traction alopecia seen in certain blacks who braid their hair. That's telogen effluvium, and the last one is alopecia areata. Androgenetic is by far the most common, which accounts for up to 95% of hair loss. Now, talking about hair loss, which is androgenetic alopecia or pattern hair loss or balding. It is hereditary thinning of hair induced by androgens and genetically susceptible men and women. It starts after puberty. This is the male pattern. 80% of men by the age of 40. I believe that should be 100%. And female pattern. Again, 60% of women by the age of 40. I believe that should be roughly around 80 to 90%. What is the etiopathogenesis? What actually causes this pattern hair loss? So, well, we all have a hormone called testosterone, both male and female. It's an androgen hormone which gets converted to dihydrotestosterone by an enzyme called 5-alpha reductase. Now, this dihydrotestosterone has nothing really significant to do in our body except for just it binds to the androgen receptors in the hair follicles. The hair follicle shrinks and slows the hair growth cycle. It causes miniaturization of the hair follicle. That is, the thick, dark terminal hair gets converted into the thin, vellus, unpigmented hair. As we just spoke, androgen on the hair follicles, the anagen phase becomes shorter. There is progressive follicular miniaturization and transformation of the thick, long terminal hair into a short, unpigmented vellus hair, which gives rise to less scalp coverage, making it look like a bald scalp. So the hair is still there. It's just that now it's not visible. The terminal hair have become vellus hair. These are the various areas of the scalp: parietal, mid-frontal, temporal, occipital, etc. This is the way how usually a person balds. There is temporal recession, then there is some hair loss at the crown, at the parietal temporal region. Finally, all of it merges, just leaving a thin rim on the occiput and just above the ears, which becomes a grade 7 alopecia. Even in females, there is central thinning of the hair. So we have psychological consequences. 78% of men with male pattern hair loss have anxiety and 22% are aggressive. 55% of women with female pattern hair loss have depression. There is low self-esteem and confidence, and there are matrimonial denials. The treatment options of pattern hair loss are medical therapy, which is minoxidil, lotion and tablet; finasteride, which is and dutasteride, which are DHT inhibitors. We have procedural therapy in the form of uh, sub-invasive procedures like growth factor concentrate and platelet-rich plasma injections. We have surgical therapies in the form of hair transplant, that is follicular unit transplant or follicular unit extraction, and hair prosthesis. Back in the days, we used to call them wigs. Now we have more fancy terms for something which is very similar to our old time-tested wigs. Now they call it hairpiece, hair system, and nowadays hair skin. So just a few words on minoxidil. It's available as a solution and as a tablet too. Uh, it's available in the concentration of 2, 3, 5, 7, 10, 12, up to even 15%. And it's available in combination with aminexil, which loosens up the fibrosis around the hair follicle, helping the hair to grow bigger and better, and finasteride. What does minoxidil do? Well, it is one of the most safest and the time-tested molecule used for treatment of hair regrowth. It is basically a potassium channel opener and hence improves the capillary microflow around the hair follicle. It stimulates the proliferation of dermal papilla cells and prolongs the anagen phase of the hair. To some extent, it can make the hair grow a little long, but not, when patients ask that what should I do that my hair become very long, you can give them minoxidil, but always with a word of caution that it's not going to make your hair double the length. Maybe it will increase it by a couple of inches because it will increase the prolong the anagen phase. Well, one third of the patients have moderate to dense hair growth, which is cosmetically acceptable. And in 71% of uh, patients who underwent hair transplant with minoxidil, they felt that the shedding was much less and the graft uptake was even better. So better evolution of the hair transplant surgery. This is before and after topical minoxidil. Again, this is before and after of topical minoxidil, but it takes at least 4 to 6 months to kick in. And we tell the patients to use it for at least 1 to 1.5 years before calling it a day, because whatever improvement is supposed to come would usually come within a couple of hair at least one anagen hair growth cycle, that is roughly at least 1.5 to 2 years. Finasteride and dutasteride. We have 5-alpha reductase inhibitor, which uh, blocks the action of blocks the conversion of testosterone to dihydrotestosterone, and this dihydrotestosterone further causes it finasteride blocks the conversion by blocking the enzyme 5-alpha reductase. Technically, it is a 5-alpha reductase inhibitor. Hence, the DHT is not produced enough to cause further miniaturization of the hair follicle. Well, indications and dosage approved for male and females above the age of 18, and in females after their childbearing age. 1 milligram for a male and 5 milligram per day for postmenopausal women or women who are done with their family planning or are beyond the childbearing age group. The only drug with the potential to reverse alopecia. The efficacy is quite overwhelming. In the first year itself, the patients, 50% of men feel that they have quite a sizable amount of their hair back, and 66% by 2 years of continued usage. Continued use of the drug helps to maintain the effect, and discontinued, the positive effect of the hair growth will be lost in approximately a couple of years. This is at baseline, then at 6 months, and at 12 months. Again, baseline, 12 months, 24 months. Again, baseline and after 1 year. Baseline after 1 year. Now, so we are done with the structure and function of human hair. We discussed about hair fall and hair loss, the various types of alopecias, and we also spoke about the mechanism of action of minoxidil finasteride. Now, talking about basic hair care. Well, that depends upon the types of hair, which is normal, dry, or oily. Shampooing and cleansing of hair, conditioning of hair, serums and lotions, brushing and combing of hair, and natural hair care products. So, what are shampoos and cleansers? Well, shampoos, it's nothing but a surfactant. It's a surfactant active agent that cleanses the hair and the scalp. The goal of using a shampoo is only to remove the unwanted buildup of the dead skin debris and bacteria, dust, etc., without stripping out so much to make the hair unmanageable. So, it has no role to play in hair growth. Various types are available for different types of hair. That is with conditioners with anti-dandruff effects, antibacterial, sun protection factors, etc. Keratin based for hair dust and citrus or tea based for oily hair, available as lotions, creams, gels, and pastes. Conditioners and oils. Well, we should condition our hair after shampooing to minimize the cuticular damage. So every time after you shampoo, you should condition your hair. These are meant to simply condition or soften the hair. They reduce the frizziness of unruly hair. The moisturizing factors in conditioners hydrate the hair. Many of them contain vitamins and minerals, biotin, calcium, pantothenate, etc. Vegetable oils are called poor man's conditioner. They have no role to play in hair growth. Also do not contribute to hair fall. However, they may only partially reduce hair fall by making the hair more combable and superficial and deep conditioning. Hair serum is a hair care solution which makes the hair shine, stops it from tangling while combing or styling. So the hierarchy of washing a hair is first a shampoo, then a conditioner, come out of the washroom, gently dab your hair dry, and then apply a leave it on hair serum. There are certain hair serums which also contain sun protection factors which protects the hair from the damage of overexposure to sunlight and also from overexposure to hair styling products. The effects of the serum application remains until the next wash. Available as shampooing serum or a stay on hair serum. It should be applied after a hair wash. Hair serum forms a thin protective layer on the hair strands. It returns the moisture lost to exposure to sun or heat generated from the hair styling gadgets. It is primarily used for dry and frizzy hair, which breaks easily, and hair that have undergone excessive chemical treatments like perming, coloring, etc. Well, about hair color, most hair colors contain paraphenylene diamine, which is the culprit for skin reactions, okay, and not ammonia, as we all wrongly blame it to be. Make sure to apply the hair color only on the head, meticulously avoiding the skin, that is the forehead, behind the ears, and on the neck, etc. Wear a sunscreen or the skin dyed areas to prevent photoallergic contact dermatitis. Like any other stress you put on the hair, coloring also makes the hair weak and can cause breakage of hair. If you are heat styling your hair frequently, be sure that you moisturize your hair with a hair serum every time you heat dry. We're talking about dry hair. They usually find the scalp to be rough, scaly, flaky in winters. Use a moisturizing shampoo. Regularly condition your hair with a warm oil. Apply a warm hair or hair towel on the scalp right after shampooing. Brown or white vinegar to be worked through the hair for better nourishment. Consult your doctor to rule out conditions like psoriasis, seborrheic dermatitis, pityriasis, amenorrhea, lupus, etc. Back in the days, we even used to see a lot of syphilis, the moth-eaten alopecia of syphilis, which of
आज
course is not that common
हाँ
these days.
आज 4:30 बजे आ जा 4:30 आ गया
Well, talking about managing hair lice and nits, well, do not neglect itching on the scalp. Always take just a minute to scan through mainly the occiput, because that is where the nits and the lice, they flourish. Uh, Always consider just having a look at the occiput to rule out nits and lices when you have a case of nuchal eczema, that is scratching and thick, rough, excoriated skins on the neck. Regular examination and cleansing of the hair, warm oil massages throughout the length of the hair to suffocate the lice. Permethrin 1% solution to be used 4 to 6 monthly in all school going children. And washing the pillow covers, bed linen, towels, combs, brushes, etc. in hot boiling water at least once a week to make sure that you have taken care of the nits and the lice. Well, my take home message is learn to fall in love with your hair. Even if they are a little unruly, frizzy, accept them. Avoid hair extensions, avoid hot hair ironing, hair rebonding, hair straightening. Use the right shampoos, conditioners, and serums for your hair. Keep them covered with a bun or a scarf while traveling on two-wheelers or when in dry, dusty weather. And daily spend at least a minute just to look at your hair, see for any nits, lice, etc., or any other scaling that you're suffering from, which could be psoriasis, seborrheic dermatitis, etc. And uh, you know just take care of your hair in a scientific way without indulging into all those products that we see marketed on Facebooks and Instagrams. Stick to good pharmaceutical medicated products which have undergone the clinical trials, etc. Thank you so much for a patient hearing.
Vita, your questions are in the chat box. Please put your questions in the chat box. Friends, yeah. Bird by chat,
There are no questions in the
just see it will come in.
I don't see any questions in the chat box, sir.
even I don't see.
Now it will come. People writing, see.
What about
Okay.
transplant?
There are 2, 3.
Yeah, put it.
Postmenopausal hair loss treatment.
Okay. Postmenopausal hair loss treatment. Okay.
Yeah.
Well, so of course it's postmenopausal hair loss treatment is, of course, that's what they're talking about balding. So minoxidil and finasteride would really help the patient. Uh, and the second question that I see is how safe is oral minoxidil? It's
Yeah.
quite safe. It's usually 2.5 milligrams a day. There are some studies and some doctors which give up to 5 milligrams per day. So talking about minoxidil, I'll just add that minoxidil actually was introduced in 1960s as a treatment of hypertension. It was an antihypertensive. It's a central sympatholytic. However, they realized that females who used to take that used to start growing hair. So that's when it was discontinued as a antihypertensive, and it was introduced in a much more refined, in a much more
Side
diluted
effect,
product.
side effect came into picture. Yeah.
Yeah,
Side effect of the
yes. So it was introduced as for treatment of hair fall and hair loss. So it's quite safe. In fact, application of topical minoxidil is even considered to be safe during pregnancy and lactation
How long to continue?
till you want your crowning glory intact.
But it then comes back to what it was, na, once
You are
you
back to
stop.
square one. Exactly. Everything is like that. It's like brushing your teeth. How long are you going to brush your teeth?
Okay, okay. Indication of GFC and PRP.
Indication of GFC and PRP, yes. So PRP is platelet-rich plasma, and GFC is growth factor concentrate. These are certain procedural interventions that we do for treatment of hair fall and hair loss. It's very simple. We take the blood, about 8 to 10 ml of your blood. We concentrate that in a centrifuge, which separates the blood into the plasma, and the platelets get separated from the red cells and the white cells. We discard the red and the white cells, and just the plasma along with the platelets, okay, is injected back into the scalp. The concept is that the platelets are the storehouse, the powerhouse of all the growth factors. They contain all the growth factors, the most common ones being fibroblast growth factor, transforming growth factor beta, keratinocyte growth factor, vascular endothelial growth factor. So all these growth factors, wherever they are injected, they grow the tissue. In this case, we intend to grow the hair tissue. Similarly, GFC is also something very similar. Instead of injecting the platelets, we directly inject the growth factors into the scalp. The process is pretty much the same. Take the blood, just put it in a centrifuge for about 10 minutes, and then the growth factors are ready, injected back into the scalp. It's done quite routinely. It's very safe as it's autologous, and we are not injecting anything alien, anything foreign into ourselves. So it's quite safe.
How many sittings are required for that?
About 3 to 4 sessions are good enough to take care of the hair fall, and maybe another couple of them at times to introduce new hair. So it's a very good supplementary treatment. The backbone, of course, still remains minoxidil and or finasteride, and these are good add-ons, these treatments.
How long to continue?
So you initially do it every month and a half for about 3 or 4 sessions, and after that you may do it once in 4 months, 6 months, or you may choose even not to do it. You know,
Okay. So at least how many you should do?
at least 4 you should do.
4. Yeah, thank you.
Sure.
You have spoke about oral dose, even how to give. So
Oral
what are
dosage, so it's to be taken at night because it can cause orthostatic hypotension in higher doses. We are not giving that kind of dose, but still it's preferably given at night. So to avoid any incidences of postural hypotension, 2.5 milligrams a day at night. There are some doctors who give 5 milligrams a day at night.
the side
Yeah.
effect of minoxidil except
Side effects of
hypotension?
minoxidil tablet is, as I said, postural hypotension. Because it's a potassium channel opener, it can cause mild lightheadedness, and three, it can cause growth of hair. For a female, it might be a bit of an issue when she has more thick hair growing near her, facial hypertrichosis. So for a man, it's okay, but for a female, she might have to just undergo the waxing or the threading or whatever she's doing a little more frequently. But I believe that is too small a price to pay to have some hair up there.
आप बोले दौड़े के सर
Next Thursday,
Yeah.
sir, holiday રાખો
हाँ holiday yeah
Enough કરી છે
When
holiday.
should we apply vinegar after washing hair?
And next week
Well, so vinegar, apple cider vinegar, and that can be applied after the washing of the hair or just before the washing of the hair at times. Keep it for about half an hour and then just have a hair wash.
Yeah, you said how PRP helps, no?
Yes,
Can we start in active hair loss?
absolutely. It will work faster than anything else. Even till the time your multivitamins and your minoxidil start acting, PRP would have taken care of the hair fall quite significantly. And it's a FDA approved indication for alopecia areata as well. So even for patients of alopecia areata, we have been injecting steroids, Kenacort and all over the years. But PRP is in fact even safer. and we don't even get the side effects of Kenacort, like skin atrophy or hypopigmentation, etc.
So it's the same PRPA and GFC, same period, at least 4 sittings.
Yes, at a difference of anywhere between 3 to 6 weeks. So between 20 to 40 days each sitting.
Can we suggest oiling of scalp in dandruff and skin infection?
No, oil is called a poor man's conditioner. Oil has no role to play in hair growth. It's only in very, very dry, unruly hair
Right.
is when we may use few drops of oil just to straighten up the hair. But oil at no point of time is going to grow the hair.
So
It's an
how,
oil. Hair is a protein. There is no scientific study which mentions that by applying a oil on the skin, it nourishes the protein underneath.
so can we GPs treat the alopecia areata?
Sorry, ma'am, I didn't get you.
Alopecia areata treatment by GP. What can we do at our level?
So, well, of course, if it's just a couple of patches, then you can surely give a steroid lotion, okay, alternate days, and
Intradermal, right?
sir, intradermal,
Intradermal.
confident of injecting and not causing any superficial skin atrophy, yes. The ideal dose is 2.5 to 5 milligram for a 1 square inch area of alopecia areata diluted. And ideally, it's to be injected a couple of bevels deep, okay, so that you inject it at the level of the hair bulb where all the lymphocytes are attacking. So you just dissipate the lymphocytes away and stimulate the hair to grow.
Okay, tablet aldactone dose 25 or 50 milligram and
Well,
minoxidil dose and how long to take it?
aldactone does not really work a lot. I mean, finasteride would be a much better anti-androgen compared to aldactone. Aldactone and other anti-androgens like cyproterone, acetate, etc., can have roles in PCOD, hirsutism, but they really don't have any established roles in hair regrowth. And minoxidil dose we just spoke
And
about, 2.5 milligrams daily.
yeah, yeah. And do plant-based stem cell serum effective?
No,
Some advertisement are there. लंबे घने बाल के लिए ये use करो, ये use करो. What is this?
No, any good
so
hair.
other than and yeah, anything other than minoxidil finasteride
No, they are
is
minting money. They are minting money. That is main thing.
absolutely. I mean, hair oil. There is this very famous company which makes hair oil. It's a 13,000 crore market. You know,
Yeah, that I'm
yeah,
telling you.
yeah. It is. There is no scientific study in any peer-reviewed journal which mentions that there were 10 patients in whom this oil was applied, and in 10 patients the oil was not applied. And the guys who applied the hair had bigger, better hair. There is not a single study in over the last thousands of years published in
Yeah.
any principle. Forget about allopathy, not even in homeopathy or Ayurveda.
There is one
Because
questioner who is asking what about hair transplant and whether you do it or not, or it is to be done by a plastic surgeon.
Well, so so these days, everyone is doing hair transplants. The president of the Hair Restoration Society of India was an ENT surgeon, and there are so many dental surgeons, gynecologists, general surgeons, technicians who are doing hair transplants. So everyone wants to have a cake, of whatever they can. But yes, hair transplant is to be done for patients who primarily have a loss of the frontal hair, where we can create a good artificial hairline for them, and it works quite well because with hair transplant I have the power to implant and expect the hair to grow exactly at the strategic areas where I want it to grow. Because with minoxidil, finasteride, PRP injections, I will do it everywhere, but it's not in my hand which hair will grow, which will not grow, how much will it grow. But with hair transplant, when I'm talking about certain specific areas like the temples, which have been bald for quite a while, and they have no potential for hair regrowth, in such areas, such conditions, hair transplant definitely has a very good role to play. But even after hair transplant, you still have to apply minoxidil finasteride to make sure that those hairs sustain.
Please suggest safe hair coloring agent.
Where any hair coloring agent which is PPD free is safe.
So the side effects, any cancer noted by applying high hair dye?
Not that I have heard of, but there are certain other serious side effects like contact, uh, uh, anaphylaxis and contact urticarias, photoallergy, contact dermatitis. These things at times can be quite grave, but no cancer is noted. Yes,
Aldactone, as you said, not to use, so no need to see whether it kidney affects in long run.
absolutely. Aldactone has not been mentioned as a treatment modality for hair growth.
So finasteride, when it's used in postmenopausal, uh, do we supposed to do any test
For
or monitoring any
Yes,
parameters?
sir, and in postmenopausal.
no,
Then
no.
no need to
Why
do
they are
any.
not allowing, why not allowing straightening of the hairs? Why
Because
not?
so straightening of the hair, that's a good question. So basically, what happens is that hair, if you see under the microscope, it's a keratin with disulfide bonds. Okay. So when you talk about straightening of hair, they first apply a chemical, then they do apply use that very hot hair iron to straighten up the hair. How do they straighten up? They break those sulfur bonds and they iron out the keratin to make it straight from curly or wavy hair. Then after that, again they apply a chemical and again they heat straight the hair using the hot air iron to again rebond them. So the way they first they break the sulfur bonds and they again rebonding. That's why the name is hair rebonding or hair straightening. Now that bond is not as strong as the way God had made it. So eventually, there is a lot of cuticular damage, and after 2, 3, 4 weeks after doing straightening and rebonding, the patient will complain of a lot of hair fall.
So which is minoxidil and redensil based serum, which is more effective?
No, so Redensil is just a biopeptide. It's a supplementary. Nothing beats minoxidil.
Okay.
Redensil,
So,
Procapil, Bicapil, Anagain, Saw Palmetto, caffeine. All these are just
serum.
they claim themselves to be some sort of biopeptide triggers and stimulants for hair, to arrest hair fall. But minoxidil is definitely still the father of all of them.
Can we do transplant after trying PRP or GFC?
Absolutely. In fact, uh, minoxidil and a couple of sessions of PRP, 3 to 4 months prior the transplant, would definitely give a better yield.
The treatment you said already alopecia areata. Uh, gray egg serum, how effective it is for gray hair?
Which one?
Gray egg serum.
Well, so from what I understand, Grey X serum contains melitane. So melitane 1% used to work well, uh, but then there were certain issues, some sort of side effects, etc. And now they have come up with another product which is called Darkenil, and they are working on the concentration of increasing melitane from 1% to 2% or even up to 5%. Let's see if something of that sort comes up. As of now, gray hair cannot be reversed.
You said how to start local application percentage and how to stop. No,
Yes.
local application. For alopecia areata, can minoxidil 10% alone for a regrowth of hair can be used?
Of course, you can use, but combining it with a steroid would further potentiate the growth.
Which supplements are good for hair fall?
Basic multivitamins, which contains, you know, all sorts of the B complex group of vitamins, and also the trace elements like copper, selenium, zinc, magnesium, etc. These micro minerals are also important for hair growth. Amino acids are indispensable. So, a multivitamin which contains basic multivitamins, then the trace elements and amino acids would be good enough. Some hair supplements also contain natural DHT blockers like pumpkin seeds, fenugreek seeds, uh, saw palmetto. They would be a good supplementary treatment for patients having hair loss because they would exert their DHT blocking effect.
Uh, treatment.
Hair dye, people are asking for advice. Which dye we have to use for coloring?
I think most of the hair dyes these days are PPD free. So I think all of them are good enough, you know.
Hmm.
And that too, PPD is something that we have been lately, trying to avoid. All these years, we were all using PPD also, paraphenylene
PP,
diet. That is the
yeah,
chemical name for black color. So
yeah,
any PPD free hair dye is completely okay because hair dye
okay.
is not going to cause any issue unless and until you are allergic to its any of its components.
Only dermatitis, yeah.
Exactly.
Role of yellow fenugreek seeds, etc., for local application for better hair growth.
Believe that even my wife does that. You know, yeah. So, but as long as it helps and make the patients happy, I just tell the patients that you can do whatever you want to apply any oil, do use any seeds, but if the hair grows, the credit comes to me and not to any of them.
So, how to apply minoxidil solution?
On clean, dry, non-oily hair, about 1.5 to 2 ml on areas of hair fall and hair loss, gently, about half an hour to 1 hour before you go to sleep.
Go to sleep.
Yeah.
The finasteride we can use in female, no?
Absolutely, you can use, preferably in females who have, who are done with their family planning, or who are in the pre or postmenopausal age group, because
Hmm.
they uh, cannot take it when they are planning a kid. So, because it can, for the fear of theoretical risk of feminization of a male fetus, because it's a DHT blocker. Even the
Yeah.
males should be avoiding 3 months prior to them planning to conceive. So, you know, uh, that way finasteride ideally should be in a female should be avoided in if they are in the childbearing age group or are planning to have a kid anytime soon.
Okay. Oral biotin and vitamin E supplements helps.
No, biotin only helps in patients with biotinidase deficiency. It's a myth that by giving biotin, hair just gets into place and it fixes all hair issues. No, that's not the case.
Hmm.
In fact,
What
there are
is the
studies which mention that biotin has no role to play in hair growth.
but all pharma companies come with biotin
Yeah,
contained multivitamin to use for hair fall.
true.
Is there any benefits of using minoxidil with derma roller?
So derma roller has been used and it's still being used. The idea is to inflict some sort of a controlled trauma on the scalp so that growth factors are produced and the idea is to grow the hair. But then there are studies uh, by a doctor in Australia. I'm not able to gather his name, but he believed that by doing derma roller more frequently, actually the patient induced fibrosis, causing irreversible hair loss. Because along with the growing of the hair, there is even fibrosis which happens to heal those ulcers and those scars which are caused by derma roller.
So not to use, better use only finasteride.
But these days, patients do walk in the clinic saying that I just bought it from Amazon, I did it for myself. It's not helping, So it's actually something. It can also cause infections. So all that needs to be done under medical supervision with caution.
Yeah, you said about the oral dose of finasteride.
Yes.
Uh, somebody wants the first slide of structure of hair.
Structure of hair. So
Meanwhile, can calcium pantothenate effective in gray hair?
yes, calcium 200 milligrams per day is effective in gray hair.
It has to be continued all the time.
Yes, yes.
So
Does
hair
advanced
removal,
hair,
uh,
uh, yeah,
extra hair removal from this thing for ladies,
Ah,
what people are using
uh,
on the mustache and this thing.
So there are
TV.
quite a few you know uh, things that you do. There are basically five things that mainly a person can do to uh, what do you call, remove the hair. It is waxing, threading, using those depilatory creams, razor, and laser. So the most scientific way of treating the hair is using a laser.
Yes,
Does hair dye apply increase more white hair?
So this is my slide on the structure and function of hair. Yeah,
Yeah.
yeah. I hope everyone can see it. Yeah.
Hair
so
dye
laser
increase.
treatment,
Sorry. Yes.
a laser treatment done on this extra hair. How
Uh,
long it lasts? Laser
so laser
again.
does last in the sense you need to do it's selective photochromolysis. So the laser rays just go and blast the black color of the melanocytes in the hair bulb. That is the
Yeah.
reason why only South American, and South Asians have the fortune of getting laser hair removal done. There has to be a good contrast between the skin and the hair. So a wheatish or a fair or a brownish skin, in background of thick, dark black hair is what is required for successful laser treatment. With every time you permanently kill about anywhere between 6 to 12% of hair follicles. Hence you require at least 6 to 8 sessions, so that every time the laser hits and blasts the melanocytes of the hair bulb, after multiple such blasts the hair cease to grow. So at least 6 to 8 sessions for Indian patients, and then further follow up every 3 months, every 4 months for the next couple of years would make sure that the patient has almost 80 to 90% of hair reduction, which has happened. Back in the days, it used to be called as laser hair removal, but then the companies were sued for millions of dollars because even if a few hair used to grow back, it's a very litigious environment in the West, and they used to sue the company. So now they call it permanent partial reduction and temporary complete removal. So
Yeah.
in short, they call it laser hair reduction and not removal
Yeah.
anymore.
Legal language they are using.
Yes,
Legal language they are using now.
true.
Yes,
Okay.
sir.
Any
Sorry, one more hypothyroid and hyperthyroid.
Yes, sir.
Hypothyroid for hair fall.
Hyperthyroid. Sorry, sir.
Hair fall, how to manage these people?
So of course, correct the thyroid underlying, because whatever treatment I give, if the thyroid is not controlled, then of course it can still keep creating its share of issues. Hence, correct the underlying abnormality of thyroid, and you know, I mean that's about it. Yeah.
They are always coming. Every now and then they are visiting doctors.
Yes, sir.
Hypothyroid, mainly hypothyroid people.
Very true.
Mm.
does hair dye apply increase more white hair?
No,
So early gray hair in kids. What supplements to use?
multivitamins, calcium, iron, vitamin D3.
Okay. If how important it is a good protein intake in our diet to prevent hair loss?
It's very important. Bare minimum is zero point 0.5 gram per kg body weight, ideally up to zero point 0.8 to 1 gram per kg body weight. And if it's adolescent age group or patients who need a high nutritional diet during pregnancy, convalescence, etc., or uh, patients who are into sports and a lot of physical activities, in them even above 1 gram per kg body weight.
Which amino acid supplements are recommended?
Supplements which contain the essential amino acids.
Okay. So what could be the reason for children 14, 15 year have gray hair and treatment?
Oh, well, these days there are nutritional deficiencies and heredity. There
Okay.
having gray hair is not a disease. In fact, having gray hair after the age of 18 is considered to be normal.
Yeah, somebody wants to know again the dose of finasteride oral and lotion in female and men.
1 milligram per day for male and 5 milligram per day for female every day.
And lotion,
Lotion is not it's not available as separate lotion. It's available in
Okay.
minoxidil. So minoxidil
Capricorn.
5% or 10% along with finasteride 0.1% is what is available in the markets. But that
Okay.
will not really make a lot of difference because that is hardly 0.1%. If it has to make a difference, it has to be a tablet.
Mm. Does laser sometimes stimulate hair growth in female with PCOS?
Yes. So if at all you are not using the right laser or the right power, we call it fluence. Okay. Not enough fluence, then actually the hair can absorb the laser energy and it can grow bigger, thicker, darker, and stronger. So that is called the phenomenon of paradoxical hair induction. So that depends, on which laser machine you use and which kind of power you use and which kind of person you are using the laser machine on.
Yeah, we are done with question. Dr. Dalakia.
One newborn is very scanty hair. Why these people are so टकलू आ गया ऐसा बोलता है सब.
Huh.
How is it?
So nothing to worry about that. That is because the in utero hair growth cycle, he would be in the
Yeah.
shed of the resting phase of the hair cycle in utero. So that's why a lot
Yeah.
of times newborns who are born have less hair in particular areas like the occiput or the temples. Nothing to worry. It actually usually all gets normal by about a few months of age. Yeah.
Not dependent on mother's this thing, diet or something.
No, no, no.
No, not connected to that. Okay. Meeta. Yeah.
Yeah,
So
thank you,
thank you very
Dr.
much.
Thank you, sir. Thank you so much.
Thank you, Saurabh. Thank you very much.
At least we knew what we can do at our level,
Yes.
and otherwise refer to Dr. Saurabh Shah. Thank you. Thanks
Okay,
a
bye.
lot.
Thank you, ma'am. Thank you. Thank you so much, sir. Thank you. Thank you,
Thank
everyone.
you, everybody
Bye.
online, doctors and Dolakia and Dr. Bharat. Jaslok Hospital for providing the stage. And Mr. Avinash. Thank you.
Thank you. Thank you, everyone. Thank you so much. Take care.
Saurabh, one of the best, very good audience you had, very good questions and very good answers.
Thank you, sir. Thank you. Truly
I
appreciate
hope you enjoyed it. Yeah.
it. Yes, definitely my pleasure, sir. Thank you. Thank you. Thank you. Good day.
Bharat bhai, yeah, thanks a lot.
Thank you, sir.
Bharat bhai, friends, next Thursday is the Dasara day. So all people wanted some holidays. We are taking holidays next week. So we'll be meeting on 9th of October, Thursday. Okay. Thank you, sir.
Thank you.
Thank
Thank
you,
you.
Meeta. Yeah. So record this thing, 110 participants. Audience was attendees were 110. हेलो या प्रणव हाँ हाँ हो गया नेक्स्ट थर्सडे इज हॉलीडे हाँ थर्ड दशहरा ही एक ही दशहरा है अरे वाह ओके वेरी गुड गुड